everyone, Melanie here with Empire Eye and Laser Center. Today we're going to do a PDO thread lift. So with Annette here, we've already done our marks of where we want the lift of the tissue to be, and we've numbed along those so she'll be nice and comfortable when we do the lift. I would argue the most uncomfortable part of the treatment is the numbing process, but then she'll be very comfortable when we do the rest of it. So if you can see the lines, we joke that she looks like she could be in the musical Cats right now. But we're gonna essentially want to pull the tissue up in this direction. So she's a great candidate because she has, mild to moderate laxity. It's not very severe. She has good skin quality that she'll be able to really get a nice lift when we put those threads under the tissue. You'll see that process, but there's no downtime with it, just tenderness and soreness and risk of bruising. But otherwise a fairly simple treatment with very significant outcomes. The benefits of doing a thread lift is really being able to reposition the tissue. So when we put filler in, we're replacing volume loss. When we do ultherapy treatments, we're helping to tighten the tissue. This is unique to anything else that I offer, that it's really picking the tissue up and repositioning it from underneath the skin. It's a unique way that it's done, and so it's really unlike anything else that I can currently offer in the office. So I'm going to insert the thread through the pilot hole that I've created, and we're just going to glide it through the tissue along the jawline. This is going to help give her a little more definition of the jawline. And then here, I'm pulling the cannula out and the thread is going to remain behind. I'm pushing the tissue to catch onto that thread. And we'll clip this. We're not going to leave that hanging out of the skin, of course, but we've left the thread and the tissue along the jawline. And this is just going to help kind of lift that skin of the upper part of the neck. So the lifting mechanism of these types of threads is that the thread itself has these molded barbs that catch the tissue and reposition the fat pads in the tissue underneath the skin. So those barbs, which you can kind of see here, are what's catching the tissue and allowing for that lift. One of the really cool things about the threads is that the body dissolves them over time and leaves collagen behind in its place. So the study showed around the 2-week mark, there's collagen growing around the thread. It takes about 8 to 15 months, so an average of 12 months for the body to absorb that thread and create the collagen in its place. So we've just completed Annette's PDO thread lift. The threads are great for that instant lift and tightening of the skin. And as the body breaks the threads down, it leaves collagen behind in the vectors that we've created. So she's always going to be grateful for more collagen under the skin. The thread lift will last about 12 months on average, and certainly can be repeated if anytime the patient's feeling like they've lost their lift and would like to repeat the treatment. It can be safely repeated. The threads again dissolve over time. There's no need to remove them. The body will break them down and build collagen in their place. So there's really no true downtime with the treatment except for risk of bruising, a little bit of swelling. Mostly the patient's going to be tender and sore, so we want her to be gentle with touching her face, no facials, no massages, no high impact exercise or yoga. For the next 2 weeks, we don't want to unhinge those threads and lose our lift, so it's really important to, even though you feel and look fine, to really adhere to the post-op instructions. And we'll see her back in a couple of weeks once it's all healed to make sure we get some after photos and touch base with our patients. So if you're interested in the PDO thread lift, give us a call for a free consultation, 661-325-EYES.